There is a jellyfish alive in the ocean right now that cannot die of old age. Not metaphorically, not approximately, literally. When its body begins to break down, it reverses. Its cells travel backward in time, returning to an earlier, younger state. Then it grows old again. Then it reverses again. Forever. It's called Turritopsis dohrnii. Scientists call it the immortal jellyfish. And it raises a question that has haunted biologists for decades, one we still don't have a complete answer to. How can a jellyfish hold the secret to human immortality? That question is driving billions of dollars, the world's most powerful technology companies, and some of the most brilliant scientists alive today. And the answer, when it comes, will not just change medicine. It will change what it means to be human. The story doesn't start in a Silicon Valley lab. It doesn't start with a billionaire writing a check. It starts in 1935, in a quiet university laboratory in Ithaca, New York. A nutritionist named Clive McKay had a simple idea. What if eating less made you live longer? He fed one group of rats a normal diet. He fed another group 40% fewer calories, just enough to survive, not enough to feel full. Then he waited. The underfed rats lived nearly twice as long. Not a little longer, twice as long. McKay published his results, and the scientific world largely ignored him. The idea that something as ordinary as food intake could control the speed of aging seemed too simple, too strange. Medicine in 1935 was focused on fighting disease, infections, tumors, broken bones. Aging wasn't a disease. It was just life. That assumption held for 26 more years. Then, in 1961, a microbiologist named Leonard Hayflick made a discovery that nobody expected. Hayflick was growing human cells in a laboratory dish, standard procedure, but he noticed something wrong. The cells kept dividing, 40 times, 50 times, and then they stopped. Not because they were sick, not because something had gone wrong, they just stopped, as if they had reached a preset limit. He tested it again, same result. He tested different cell types, same result. What Hayflick had found was a biological clock hidden inside every human cell. Each cell can divide roughly 50 times before it locks up and refuses to continue. Scientists now call this the Hayflick limit, and it meant something profound. Aging wasn't random damage accumulating over time. Aging was, at least partly, programmed, built in, scheduled. The body had a timer, and nobody had known it was there. But here's what made this truly dangerous knowledge. If aging was programmed, then maybe, just maybe, it could be reprogrammed. That idea would stay mostly theoretical for another 27 years. Until one scientist looked at the smallest possible animal and found something that would shake the entire field to its foundation. Remember the question from the opening? About the jellyfish? About how a creature with no brain, no spine, and no laboratory could hold the key to human immortality? We're getting closer. But first, you need to understand what happened in 1988. Cynthia Kenyon was a molecular biologist at the University of California, San Francisco. She was studying C. elegans, a tiny worm barely 1 millimeter long that lives for exactly 21 days. Scientists loved this worm because its entire biology was simple, transparent, and fast to observe. Kenyon made a single change to one gene out of roughly 20,000. The worm lived for 42 days, twice its normal lifespan, in perfect health, fully active, right up until the end. Stop. Before we go further, you need to understand something. This was not a small result. Doubling the lifespan of any living creature with a single genetic change had never been done before. In human terms, this would be the equivalent of living to 160 years old. Not in a hospital bed, but healthy and functional. Kenyon's discovery proved that aging was not fixed. It was not inevitable. It was, at least in part, controlled by specific biological switches, and those switches could be moved. The scientific community paid attention this time. Money started moving, slowly at first, then faster. In 2010, a British biomedical researcher named Aubrey de Grey co-founded the SENS Research Foundation in Mountain View, California. SENS stands for Strategies for Engineered Negligible Senescence, which is a scientific way of saying a plan to stop aging entirely. De Grey's argument was blunt. Aging, he said, is not a natural condition to be accepted. It is damage accumulating in the body over time, and damage can be repaired. He identified 7 specific categories of cellular damage that he believed caused aging, from mitochondrial mutations to the buildup of toxic proteins inside cells. Fix all 7, he argued, and you don't slow aging, you stop it. Most of the scientific establishment thought he was a radical. Some called his ideas dangerous. Others called them fantasy. He raised money anyway. And then, in 2013, Google did something nobody saw coming. Google, the company that organizes the world's information, decided it wanted to solve death. The company launched Calico Life Sciences, short for California Life Company. Google's parent company, Alphabet, committed $1.5 billion to the project. $1.5 billion, directed entirely at understanding why living things age and how to stop it. The message was clear. This was no longer fringe science. This was a technology problem. And the most powerful technology company on the planet had decided to work on it. Investors followed. Startups multiplied. A company called Unity Biotechnology focused specifically on senescent cells, old, damaged cells that stop dividing but refuse to die, poisoning the tissue around them like a rotten apple in a barrel. Unity's pitch was elegant. Clear out the rotten apples, and the body heals itself. In 2018, Unity Biotechnology went public on the stock market. Investors valued the company at $700 million on its first day of trading. $700 million for a company with no approved product, no completed human trials, and no revenue. That number alone tells you how much the world wanted this to be real. The field had a momentum it had never had before. Billions of dollars. The world's best scientists, the most powerful companies on Earth, all pointed at the same target. And then the FDA, the United States Food and Drug Administration, the agency that decides which treatments are legal in America, did something that changed everything. In 2015, the FDA approved a clinical trial called TAME, targeting aging with metformin. This was not a small regulatory decision. This was historic. For the first time in the FDA's entire history, a drug was being tested not to treat a specific disease, not cancer, not diabetes, not heart failure, but to treat aging itself. The FDA, for the first time, was acknowledging that aging might be something medicine could address directly. Metformin is a drug that has existed since the 1950s. Doctors use it to treat type 2 diabetes. It costs almost nothing, roughly $4 for a month's supply. But researchers had noticed something strange in large patient databases. Diabetic patients taking metformin were, on average, living longer than non-diabetic patients who weren't taking it. They were living longer than healthy people. That made no biological sense, unless the drug was doing something to the aging process itself. The TAME trial enrolled 3,000 people across 14 research sites in the United States. The goal? Prove that a cheap, existing drug could slow the biological clock in humans. Remember the question from the very beginning: how a jellyfish holds the secret to human immortality? This is where it connects. Turritopsis dohrnii reverses aging by changing the behavior of its own cells. Kenyon's worm doubled its lifespan by switching one genetic signal. Metformin appears to activate a similar cellular pathway, a signal called AMPK that tells cells to repair and conserve rather than grow and age. The jellyfish does it automatically. Scientists are trying to teach human cells to do the same thing on command. But here's what no one saw coming. While the TAME trial was building momentum, Unity Biotechnology, the $700 million darling of the anti-aging investment world, ran its first major human trial. They targeted senescent cells in patients with painful knee conditions. The science was solid. The animal results had been clear. The investors were confident. The trial failed. The drug showed no meaningful benefit over a placebo. The stock price collapsed, falling more than 65% in a single day. Hundreds of millions of dollars in investor value evaporated before the market closed. It was a brutal reminder. Biology does not care about valuations. It does not respond to enthusiasm. And the gap between a result in a worm and a result in a human being is vast, unpredictable, and sometimes impossible to cross. The failure of Unity's trial did not kill the field, but it changed it. Investors became more cautious. Scientists became more careful with their language. The word cure disappeared from most press releases. The word slow replaced it. The stakes, though, had only gotten bigger. Here is where we are today. The TAME trial is still running. Results are expected within the next few years. If metformin proves it can slow biological aging in humans, it will be the first drug in history with that label. Every doctor on Earth will have to reckon with what that means. Parallel to that, a new generation of research has emerged around a molecule called NAD+, a chemical that exists in every cell in your body and that declines sharply as you age. Researchers at Harvard Medical School, led by David Sinclair, have shown that restoring NAD+ levels in old mice makes them biologically younger, their muscles stronger, their organs healthier, their cells behaving like those of much younger animals. Human trials are underway. Results are not yet confirmed. But the direction of the evidence is striking. And then there is the jellyfish. Scientists are now actively studying the molecular mechanisms that allow Turritopsis dohrnii to reverse its cellular age. In 2022, a team of Spanish researchers published the first complete genetic analysis of the Immortal jellyfish, mapping exactly which genes activate during its reversal process. Several of those genes are directly related to DNA repair and cell reprogramming. Humans have versions of the same genes. They just don't activate the same way. That gap between what the jellyfish does automatically and what human cells would need to be told to do is exactly where the next decade of research is focused. The money has not stopped. As of 2023, anti-aging biotechnology attracts more than $5 billion in new investment every single year. Jeff Bezos, the founder of Amazon, has personally invested in a company called Altos Labs, which is working to reprogram human cells to a younger state, directly inspired by the same biological mechanism the Immortal jellyfish uses. The field has moved from the fringe to the center of global science in less than 30 years. From Clive Mackay's underfed rats in 1935 to Hayflick's cellular clock in 1961 to Kenyon's doubled worm in 1988 to a $5 billion annual industry today, the trajectory is undeniable. But the question that no scientist, no billionaire, and no regulatory agency has answered yet is not biological. It is human. If aging becomes treatable, if a drug or a gene therapy or a cellular reprogramming protocol can extend a healthy human life to 120 or 150 or beyond, who gets access? Does it go to everyone or only to those who can afford it? Does a world where some people stop aging and others don't become more equal or less? The immortal jellyfish has no answer to that question. Neither does the worm. Neither does the mouse. Only we do, and we have not yet decided. For all of human history, aging was the one thing no power on Earth could touch. That may be about to change. And the hardest part won't be the science. It will be deciding what kind of world we want to live forever in. If this story surprised you, subscribe. We release one of these every week.